Welcome back to my YouTube video channel. I am so excited today to have Dr. Amanda Wilson, one of the doctor that I've been follow her YouTube channel and follow her trend from an evolutionary way of helping general dentists and practitioner dentists around the world to do dentistry, especially orthodontists. And she has some passion to share with you guys today. Dr. Amanda, I want to introduce you first.
Thank you.
Dr. Amanda graduated at UCSF 2001, many years ago, and did the orthodontist residency at University of Connecticut and graduated 2004. She is the CEO and the founder of Straight Smile Solution. And I would like to ask Dr. Amanda, how did you come out to convert this? Can you tell us a little more about your company and how does that go about?
Sure. And I think all of us, we go to school and we go to residency thinking we're just going to do what we're supposed to do. We're going to have a practice. We're going to do that until we retire. And that's what I had intended. But sometimes life throws you some curveballs. So for me, just in a nutshell, I ended up marrying my classmate, Dr. Darren Wong. He's from Hawaii, and he wanted to move back to Hawaii to take care of his parents. And that was part of our agreement when we got married, that I realized that was part of his culture, the Chinese Hawaiian culture. So we moved back to Hawaii. And when we moved back, ended up, it was challenging having two of us practicing. I know if anyone's married their classmate or is married to another professional, be it in medicine or dentistry, anytime you have a sick kid, it's like, okay, who has the most production on the books today? Who's taking the day off, to take care of these children? Right. So we ended up coming to an agreement that I was going to, quote, take an early retirement. I didn't know what that meant a couple of years ago. It was about 8 or 9 years ago, to focus more on our kids. Turned out my son was interested in being a professional swimmer. And now he's actually going out for the 2024 Olympics. So I decided to do something else in orthodontics. So that's how I started doing consulting and product development. And that's how Straight Smile Solutions got born, just helping out general dentists, first my husband, then his friends, and then it turned into a whole business. And on the side, I get to take my business wherever I go. Last week we were in Texas for a national level meet, and it's been just such a blessing. But hoping as soon as my kids get off to college, I can start practicing again.
I see. Yeah, I mean, when LinkedIn start becoming like popular for other profession, but then I see dentists start joining, and I see that you start your company years ago, and I was one of the one that I tried to see what you do, and it's just when now I look at your company, it's become very well known around the world. And I see that you consult people in other countries, like Hong Kong, Japan. That is amazing. And would you tell us why GP? Why pediatric?
Why not GP? Yeah. So, about 15 years ago, my husband and I, we were practicing in different locations, and he said, hey, I want to start doing some Invisalign. It doesn't seem that hard. And I go, oh, no, you shouldn't do that. Just refer to the ortho. And he said, no, I'm going to do it. So either you help me or I'm going to wing it. So I said, fine, I'll help you. So luckily, I mean, here's the thing, just like with optometrists and many other professions, sometimes technology just gets better and it makes it easier for other people to adapt and try it. And that's what has happened with orthodontics. There's always still going to be a place for orthodontists, for the harder cases, but for the mild to moderate cases, or even the easy interceptive growth and development cases, airway cases, there's no reason a pediatric dentist or a GP can't do it. I'm not trying to take away business from the orthodontist, but I think the more that you're aware and you learn some basic knowledge about it, the more we can provide access to care to patients. What's really most heartbreaking to me is when I get a patient who's maybe 16, 17, 18 with a really bad malformed jaw that we could have fixed when they were 7 years old, if only their general or their pediatric dentist knew basic orthodontics, because some, parts of the country and the world, there is no orthodontist that's available. So that is really my mission and that's why I started my YouTube channel, is to provide free, good orthodontic education to every dentist that's out there, and also consumers, so they know what's out there, really unbiased. And a lot of the education that's out there is affiliated with a particular brand or a company, and that's not our goal. Our goal is just to educate you and just to give free information.
I totally agree, because I know that because as general dentist I do regular braces, uh,
Good.
but I realize that what you put on YouTube channel is like entire world for me to learn, and I
Yeah.
haven't really able to learn all of what you put there, but there's a million of information
We
there that
have
can help.
4,200 videos to date. That's how many videos.
Yeah,
I
I
went kind of
mean,
crazy during COVID because it got really slow. So
I think it's a compassion, it's a passion and
it is
compassion
a
and a
passion.
kindness that
Yes.
you do it, and you do
Hmm.
this. I don't think you do it just because you want to be proud of yourself, but I think that you do
No,
it because you want to share the knowledge, you want to
I
educate the
do.
people,
I
and
want there to
that's the
be a
difference
legacy.
between yeah,
Hmm.
I see that the difference between like somebody who just show a couple of things versus somebody
Hmm.
who share the entire world. So this is an evolutionary type of education that someone from Vietnam, from China,
Yeah.
from Laos, whatever country,
Hmm.
they can learn from your YouTube channel. And I encourage
Thank you.
those of you who started the journey with this conversation right now, go to the YouTube channel, Smile, Straight
Straight
Smiles
Smile Solutions.
Solution, or
Yes.
you can just type
Hmm.
in Dr. Amanda Wilson. You're gonna see her
Yeah.
everywhere, and
Hmm.
she is a kind teacher. She show everything there. I see so much information that people can learn. I just
Thank
want to
you.
talk to you a little bit about. I know you're not focused on just general dentist or or pediatric, but you also consult with multiple technology company related to
Mhm.
orthodontics. Can you tell us the company that you are working with right now? Some of the company.
Oh, I mean, I'm not really directly working with that many
Mhm.
companies, but sometimes companies, be it an aligner company or a 3D printing company or anything, will just, want to consult with me just to get some idea of where the trends are going and everything like that. But I don't directly work for any of these companies anymore.
Mhm.
I mean,
Mhm.
if you're referring to my time with Smile Direct Club, I don't mind talking about that. I did
Mhm.
help start that company back in 2014. I know a
Mhm.
lot of people are upset about that, but
Mhm.
that is something, it was a challenge, and we didn't even know what the company was yet. The whole goal was really just access to care, and can we create aligners without attachments that can be done. And they took it maybe a very different direction than I would have taken it. I was only with them for about 2 years,
Yeah.
but the fact is it can be done, and everyone said it couldn't be done. So that was really a cool thing for me to watch that company succeed.
Yeah, that's something you must be proud, because
Yeah.
a lot of doctor or dentists or
Yes.
orthodontists or anybody,
Hmm.
like when we learn whatever in school, our mind just close with that information,
Hmm.
and you don't want to break any kind of creativity and learn and do something that extraordinary. So what you have done is just open up
Thanks, Doc.
a
Thank
lot of
you.
stuff for the world. And I see, like just like you mentioned something about teledentistry,
Mhm.
like I was always thinking, like a lot of dentists, a lot of orthodontists, a lot of clinicians were thinking, like, how can you follow up the case by not just not seeing the patient, but you just work with the the those app or the teledentistry. Would you share some of the
Sure,
yeah.
sure. I mean, when we first started in 2014, there really weren't any AI or artificial intelligence companies where that could, track using a cell phone, but now there are. You got dental monitoring system, you got Align Flow. There's a lot of really cool teledentistry apps that you can use for aligners or even any type of dentistry, where the patient can just use their phone and connect with their dentist. And what really happened during COVID is that we had to rely on this to communicate because we couldn't see our patients in the office. So that really took off. And a lot of orthodontists have actually changed their whole scope of practice. Now, sometimes they're really not seeing their patients at all. Their braces patients, they still have to see, obviously, because they have to tighten the braces, right?
Mhm.
But their aligner and their interceptive and their removable appliance patients, they can do mostly remotely once they deliver the appliance. So it's really convenient for patients. And it's really fun and modern and sophisticated. And I think it's just a new way of orthodontics for sure.
You mentioned about the Alive Flow. Have you worked with them?
Oh yeah.
Hmm.
Yeah,
What
it's
do you
a
think
cool
about their
app.
app? The app is good.
Yeah, I think it's really cool. And they have a lot of new stuff that I can't really talk about it because I'm always checking in with them, but I know they're
Mhm,
about to release some really cool stuff. So keep
mhm.
your eye out for some neat press releases that
Okay.
are going to come out. But yeah, I mean, one thing I like about Align Flow is it's an affordable way to check in with your aligner patients. I think it's somewhere around $140 last I saw for up to 30 patients. And that's, that's reasonable.
Mhm.
That's less than, it's about $7 per patient per month. It's a lot less than dental monitoring, and you don't have to buy a scan box. You can just use your phone. Slightly different program, but it's definitely something I feel like you could get into it without having to pay a huge fee or, a lot of money. So it's a great idea to add that to
people
your team.
people might concern about, like, when you do auto, you have to see the occlusion. So with those app,
Mhm.
how can the patient take a picture of their occlusion? Did you have any?
You can. I mean,
Okay.
I recommend giving the patient, you can buy retractors from eBay or from Amazon in bulk for about
Mhm.
80 cents each. Give your patient a retractor. We have the patients put the aligners in, take pictures, take them out, take pictures. You can also even give them some articulating paper and they can tap, tap, grind before they take their pictures. And then I can see exactly where they're biting down. And of course, it doesn't mean we're not going to see the patient at all, but
Mhm.
if they're tracking and everything's going as planned, and if you have a really, really good clean check or a good aligner setup, and we're not having any concerns, no discomfort, then you can keep doing the remote check-ins, if it's permitted by law in your state.
Mhm.
And of course, if you see anything that concerns you, then the patient's going to come on and see the doctor. So that's really, it can eliminate like 90% of the chair time in your aligner and functional appliance cases, which, opens up. I mean, think of how much money you're saving all that chair time.
I love it. I think this is something that, when you talk to somebody like a pioneer in technology, like using the adapt to a new technology like you are,
Mhm.
then you see your eyes different, your vision is different. But the people who are
Yeah.
so conservative, they look at like, what are you talking about? But I believe that. I believe that, when you are a pioneer, when you merge with the new technology and you use it and you fix it and you build it, it's become a powerful tool for
Mhm.
what you do. I
Yep.
agree. Yeah,
Yep.
it's wonderful. I talked to them recently too, so I know that it's working there. Yeah. Anyway, can you share us about the future of braces? Like, let's say,
Sure.
the is, are we mostly going to do Invisalign, or are we going to do a little bit of brackets as well? Can you
Depends. I mean, in my hands, I can pretty much do everything with. I know I keep saying Invisalign, but it could be many different types of aligner companies. We also in our office, my husband's office, we use white label aligners as well, which is in-house 3D printed aligners. Unfortunately, in Hawaii, we don't have enough. Like the square footage of the office is so expensive, so it isn't really cost efficient for us to have a lab and do our own 3D printing. It's also kind of smelly, but
Mhm.
we do outsource the 3D printing, but we can still do this for about $20 per aligner, which is really affordable. We do outsource the setup, so it's about $90. So if anyone is interested in getting started with that, I'm super glad to make introductions and give you some onboarding videos on that, especially if you're in the US. If you're not in the US, might be a little bit different, the pricing and everything. But that's pretty cool. But yeah, with Invisalign, I mean, we're even doing my husband's doing my daughter's case. She's 13 and she even has pallidly impacted canines, and we're doing with Invisalign. And this is, as far as I know, the only second case that they've published. We're planning to publish it when we're done. It's tricky. I mean, it's a little easier with braces, don't get me wrong. It's a
Right.
hard case, but it's doable. You can do almost everything with Invisalign if you know what you're doing. But I
Absolutely.
really do believe you got to understand the fundamentals of braces first. If you don't understand the fundamentals of braces, you're not going to understand how to do Invisalign right. So I'm not saying we're getting rid of braces. Matter of fact, I recommend all my orthodontists,
Mhm.
dentists
Yeah.
who do ortho, to do some bracket and wire cases, because you're going to really understand how teeth move better if you do that.
That's so amazing. I mean, thank you for sharing the what you do in your office, and
Mhm.
the tip that you're giving out there. That even if anyone, you guys listen to this conversation
Yeah.
and you hear Dr. Wilson talking about the lab that you can share, can save
Yeah,
the cost,
anyone
please
can contact me. Yeah,
contact her on her website there.
yes.
That's wonderful. I never, I mean, I when I do the regular braces, and I feel like how these doctor using Invisalign so much,
Mhm.
or clear correct, but you mentioned that it seemed like you have a confidence that most of the case can be done with that. That means that in the future, the generation of the new orthodontists, or the doctor that do ortho, their office doesn't have to be extremely big.
No, no. Yeah, I mean, and think about this. And listen, I'm not trying to get rid of office staff, but
Right.
listen, in California, where I was working,
Hmm.
staff, like licensed RDA EFs that know for ortho RDAs, they're expensive, like $45, $50 an hour.
Right.
That's a lot of money.
Yes.
So with Invisalign, I don't have to hire them. So, or maybe just one to put on the attachments, not six, you know? So that saves me a lot of money in my office and space if you do a lot of things virtually. So if you create an almost entirely removable practice, you can do everything pretty much virtually. I mean, occasionally they're going to have to come in. I wouldn't recommend taking patients from other states or anything like that. I mean, they need to be able to come in if they need to be able to come in.
Right.
But wow, I mean, you can save, you basically, what a lot of orthodontists are doing is they're hiring one what we call virtual staff member. So that they don't even have to necessarily be in the office. They can work from home or they can work in the office, but they're just working with the virtual patients. They're seeing those patients through Zoom or through Doxy or one of these apps, you know, or AlignFlow, and they're just communicating with them every day, seeing them in real time, either
Saving.
synchronously or
Oh,
asynchronously. Yeah, pretty cool stuff. So, and a lot of
amazing.
people
Yeah.
think that's a really cool job, is to be a virtual dental assistant.
Right. Oh my God. You just open up so much opportunity for us to think about it. Whether you are a general dentist, a pediatric, or an orthodontist. Just think about how the world can be changing to the next level of practicing.
Yeah,
And you are a pioneer. You sharing these things to
thank
people.
you.
People don't. Sometimes we don't get it until we hear from the expert.
Right, right.
So.
And let your readers or your followers know that on our YouTube site, which again is Straight Smile Solutions, we have like 10 playlists. We have one for Invisalign, one for braces, one for phase one, airway, myofunctional. So one for impacted canine, cephs, everything you want to know. It's almost like reading a textbook. There is a playlist for that. So you can just wade your way through it. It might take you months to get through all the
Right.
data,
Yeah.
or
Yeah.
watch the stuff that's interesting to you. We're always updating stuff. And if we don't have something,
Mhm.
send me suggestions, because that's basically how I make these videos. People send me suggestions every day. I make about 3 or 4 per week. Only thing I'm not doing too much is like jaw surgery videos or TADs, just because that's not part of my business model. I'm
Mhm.
working with general dentists and pediatric dentists, and I don't want you to do those cases. I
Right.
want you to refer those cases back to the orthodontist.
Mhm.
So I'm purposely not doing the super, super hard stuff, keeping it
Right.
easy.
Yes. Yeah. Yeah. So, so for those of you that were you are an orthodontist, you listen to our conversation, you see that there's a niche for an
Hmm.
orthodontist, because no matter how well experienced and a general dentist been doing ortho, you still have some case that it's very important to refer to an expert. So
100%.
and
Hmm.
and require surgery, require
Hmm.
multiple disciplinary consultation.
Yes.
So it's important to realize that uh, even you do phrases, but there is something else that you cannot do, and that's where
Hmm.
the expert need to do. And but the conversation right here, it just basically it helps to open up everybody to listen and see that what are the opportunity out there that we can do. And you mentioned something I just don't want to forget, is the so you mentioned that for oh yeah, the you have a lot of video. Are you providing some on a CE course?
Oh, personally, I don't like to deal with it because it's a
Mhm,
lot of work, but sometimes like I
mhm,
get sponsored. So for example, Garrison Dental, I work with them a lot.
mhm,
They make those matrix bands and stuff. So I'm doing an IPR course that will have CE in May.
mhm, mhm,
I think it's May 20. No, I don't remember what day. May 17th, maybe. So if you go to Garrison Dental, or you can go to my website, Straight Smile Solutions, it's under webinars. But yeah, I mean, whenever someone sponsors me, I'm this summer, I'll be in Nashville with the dental festival, Smiles at Sea, and we are offering CE for our course, Action to Win. So hopefully I'll see y'all there. And it definitely, if you're going to any of the stuff that's in destination, let me know ahead of time because I'd love to meet you.
Sure, I will. Action to Win sound like familiar with Dr. Emily that
Yeah.
trains. Is he
Yeah, that's
going?
exactly. Yeah.
Oh,
Are you
okay.
going?
I will see. So is that what day? What day? What month?
I'm lecturing. So the Action to Win is on the 6th and 7th of July at the Dental
Mm,
Festival in Nashville, but I'm lecturing the afternoon of the 7th, just a brief high level ortho course in the afternoon. But
yeah.
that's a really cool course. It's going to be a lot of really business learning about the business of dentistry and everything like that, and how
Mm.
to make your business more productive.
Yes. All right. This video can be shared for Dr. Emily. He would be excited to
Great.
hear that. A
Hmm.
couple more things you mentioned about the IPR. Is
Hmm.
that something would consider? Is there a side effect or a harmful effect in long
Oh,
term for
okay.
patients? Yeah.
I mean, obviously you need to, case selection is important. I mean, I don't
Mm,
like to do IPR on 10-year-olds or anything like that. A
mm,
lot of it, you got to look at the shape of the teeth and think about the bite, but and you need to do it accurately. If you don't do it right,
mm,
then you're going to have a lot more refinement. So it's going to be cool. Our course with Garrison, where it's a hands-on course. So there is a small fee to sign up. It doesn't go to me. It only goes towards your supply, and you'll
mm.
get a kit with IPR strips and a typodont, and you're going to follow along as we show you exactly how to do IPR. And then you get to keep the kit. So,
So that
and you
would
get to
be on
see.
July.
No. That one I believe is May 17th. It's on my website. If you go to Straight Smile Solutions, find webinars, and then it's there. You can sign up,
And
but it's reasonable. It's something like $200 or $300, but you get the kit, which costs that anyway.
did you
So,
say is that in person or
no, that's a webinar.
oh
So,
webinar? Okay.
with
Okay.
Garrison, but the
Got it.
next in person I'm doing is going to be Dr. Emily's course in
Got it.
Nashville, Action to Win. Mhm.
Beautiful. You mentioned also about you focus on airway. I know. Can you
Mhm.
tell us a little bit more because the evolution of orthodontics now changed. Like we're trying to do
Yeah.
minimum extraction.
Yeah.
And can you tell us?
Sure,
Yeah.
sure, sure. And when I was trained, I mean, I feel like I was trained in a different generation, and I really was.
Mm,
Did a ton of extractions. That's just how we did things. And in my mind, I started putting two and two together because I started also seeing retreatment cases coming in when I was in residency that had 4 buys out that all had sleep apnea, and they were struggling. And I was putting two and two together, but there still really is very little published literature linking the two. So this is just like a suspicion.
mm,
But and then really flattened profiles. So in my mind, I was like, I don't feel right doing this. What if there's another way? What if there's another way? So I started really getting involved in interceptive ortho, just because I felt so terrible seeing these older patients really suffering. And my theory is, if we start really focusing on airway at age 4, 5, 6, 7, habits, moving teeth forward instead of moving teeth back. I mean, we did tons of headgear, in residency, like headgear. I'm not talking about protraction face mask. I'm talking about like headgear, neck gear that goes
mm,
around your neck,
mm,
chin straps, things like that. And, that's just not the way ortho works now. We try to move everything forward. So
mm.
that's really my goal.
So clear, correct, a clear aligner, thing like that. We can do that. We can move teeth forward.
You can. I mean,
Mm,
the idea is that we're expanding arches, not constricting arches. So
mhm,
that's definitely a part of it. But what the cool thing you can really do is if you start with phase one, I know I keep going back to phase one interceptive, but it's really my favorite ortho. Finding these kids, I mean, before, people say, oh, you don't send the patient to ortho until they're 7 years old. Well, sometimes that's too late. So I like to say, let's do an ortho evaluation on 2, 3, 4, 5. I know that sounds nuts, but there's actually things you can do that are easy and comfortable, and you don't have to take panos or take impressions or anything like that. But just to start fixing these bites and getting them used to wearing appliances that will help them nasal breathe. And the lab fees are as low as like $50. I mean, really, really cheap. So it goes up from there, but there are systems that are out there that are really low cost. These are US prices, of course. And you don't have to take a class or anything like that to get certified. A lot of cool stuff out there that works. And I'm working with a lot of doctors who are doing these cases and just watching them transform. You're taking a case that would have been an extraction case or a jaw surgery case if you had waited. And maybe this patient won't even end up needing braces, or if they do, it's just going to be a really simple, a few months in braces or just 10 aligners or something like that, because we're fixing the bites when they're little. And I'll take a 6, 7, 8-year-old any day over a teenager. I mean, I have teenagers at home now, they're 13 and 16, and they're difficult, you know, they're annoying. And they don't want to wear things, and they're too busy. They don't want to go to the dentist, you know, they're so busy, so much homework and studying and things like that and activities. These 6, 7, 8-year-olds would love to wear your fun, shiny appliance, and they'll even wear it to school, and they're going to be super compliant because they think it's fun and cool. So this is, I think, the future of orthodontics is younger. And of course, I mean, look at Invisalign. Their newest product that they're really advertising now is their Invisalign First. And this stuff really does work. It's pretty amazing.
Wow.
Mhm.
You know, it's something I love to learn. Do you have some video on your YouTube about
Yep.
talking about this early age?
Over 100 videos. There's a channel just for phase 1 interceptive airway and myofunctional. So I think we've got 110 videos or something like that, if not more. I don't even count anymore. So yeah, check it out. We've got everything you
I
need.
will check it out. You guys, when you listen to this conversation, check her YouTube channel out.
Thank
She
you.
is so kind to do this with
Thank
the
you.
love of what her knowledge that she want to share. That you don't do this just for fun. She have a passion. So,
There is a passion.
oh my goodness. I agree with you. I mean, if you can do something with the kid at that early age, you don't have to work so hard in when they turn to adults.
Yeah. And if you do a kid, you're probably going to get the siblings and the parents too. And then the cool thing is the kids and the parents thinks it's so fun that they take pictures and put it on Instagram and they tag you. And then you get 10 more patients. It literally, everyone that I know that really gets into phase 1, whether they start with their own kid or their staff's kids, it literally snowballs into a huge ortho practice. And then all these patients, like I told you, are going to need probably a really easy phase 2 later that you can definitely handle. So you get 2 patients for one, you know, basically. But I mean, telling you, it literally grows and feeds your practice. You need to feed your practice with younger patients. And this is exactly how you do it. And it's really the mistake of orthodontists, because if they're not doing a lot of interceptive in phase 1 in their practice, it's an opportunity for you. And I say go for it if they're not going to do it.
Okay, thank you so much.
Sure.
So with your court on the on YouTube,
Mhm.
is there should we get certified or should we know more, or your YouTube is very comprehensive already?
I mean, I don't think it's not an official course. It's just a ton of videos. So, I mean,
Mhm.
I
Yeah.
don't want people to have to pay for knowledge. I believe knowledge should be free. So I put it out there, you know, and there are courses that you can take. I mean, I think everyone should get certified in Invisalign just because I think it is the best aligner product for difficult cases at this moment. I'm not saying for easy cases. For easy cases, you can do pretty much anything. I don't have any, but for harder cases, plus they also have the MA, which is a really cool feature, which is proprietary and no one else can do it because it's patented. So that's why I love Invisalign, but I don't work for them. So you know what? They don't give me any money or anything.
Yeah.
I just talk about them because I think it's good. And I'm comfortable. I'm really, really confident with that product. But I think that you should be Invisalign certified. Also within the Invisalign, you know, you can take and be certified in 45 minutes. You're not going to learn anything from that course. It's going to cost about $3,000. But from within there, their education portal is also very helpful. You're going to learn a lot from that. So I think between Invisalign, getting certified and taking all their courses that are free, and then all my free courses, you pretty much have everything that you need to start ortho. You shouldn't have to take any other courses. And if you want to do straight wire, I mean, I'm sure you've been doing it for some time. I mean, it takes some time to learn to put brackets on, right?
Yep, it takes time.
Yeah. So I recommend doing indirect bonding to get started. You can do this for as low as I know there's some companies that are doing indirect bonding that are $700, $800, $900. That's too much, you know, in my opinion. You can do it. I have a company I work with. It's only $350. These are 3M Unitech brackets with the transfer trays, everything included, including the setup. Super affordable, you know, top of the line brackets. I mean, why not? That's a really low fee, and you can invest. I'm glad to share this with any of your listeners. If they want to contact me, I'll give them the price list of what you need. I've kind of created my own list of what you need to start straight wire. It's about a $1,300 investment for the initial, you know, ties, springs, wires. That's not the brackets. It's just the consumables that you need for us, you know, simple cases. But that's all your investment is. You know, it's just that. And then $350 per case. So there's no reason you cannot start that. And you could just start learning on a Typodon. I put all the videos on my channel. If you don't want help, if you just want to do it yourself, just get a Typodon with brackets on it from eBay for $30 and just, you know, start practicing.
So really quick, you guys, I just want you guys to explain to you guys, those of you that don't do braces, you don't know what we're talking about. Indirect bonding mean that
Mhm.
the brackets is already on the tray. You just need to clean everything up, ready, and just bond to the tip and hit the
Yep.
light and cure. You don't need to
You don't
be.
even know how to place them, because if they're
Mhm.
gonna, the technicians will digitally place it. Now, this being said, not all indirect bonding is the same. So there's some ortho labs that offer IDB, and it's junk. It's really bad because they don't know, they're not using a computer to place it. They're just, their technicians are just guessing. So I've seen some really, really bad indirect bonding. So make sure that they're giving you the STL or the image of the brackets on the model first, and run that by an orthodontist or a dentist who knows how to place brackets to make sure it's done right.
The
Once you know
best
they're doing it right, then you're good.
the best thing you guys is contact Dr. Wilson to learn more,
Thanks.
because
Yes.
she been there, done that. She know exactly what she's talking about. So that
Thank
is
you.
wonderful. And one other thing I love you just mentioned is you said that you believe that knowledge is to share, and you
Hmm.
don't keep it like that. I do the same thing on my channel.
Hmm.
I do a lot of video for general dentists, and I share it. And because what I at UCSF, I was lucky or blessed enough to learn a lot of technique from the prosthodontist and
Hmm.
endodontist and orthodontist and oral surgeon. So I combine together, and I just feel like it's knowledge we got to share, and that's what
Yeah,
I do in my YouTube channel too. So
great. I can't wait
yeah,
to check out your videos. I'm
yes.
cool. I'm excited. Yeah.
Yeah, I love, so far we share so much information, and I just want to wrap it up. And Dr. Wilson, is there something that you want to share to the audience, listen about what you do for or the orthodontist company, or any company that technology company, anything that you want to share to the audience that we have?
Not really, just that I do welcome every dentist to contact me. I offer a complimentary session. I mean, we're not going to be going over a case, but if you just have questions about ortho or you just want to talk about it, that is free. So you can just go to my website, go to contact, and go ahead and make an appointment. And it's just a phone call. We won't be on video or anything, but we'll just be chit chatting and fire away with your questions for sure. I offer that as a complimentary service.
Let me do a quick share screen so that people are aware of the website. That's way.
Oh, thank
Let
you.
me see if I can do really quick here. Do you
All
see it?
right.
You see it?
Yes, yes, yes. So see the contact us in the right top right corner. That's how you can make that free appointment. And then if you want to go to the classes button, that's where you can access all my YouTube. If you can't find the YouTube, yes,
Mhm.
complimentary orthodontic educational videos. They're all right there. So and then if you want to go to the webinar, that's where that Garrison IPR webinar is going to be.
Got
So
it.
perfect. Yeah.
Now, lastly, before you go, I see you have a team, and you do have a doctor
I do
from
have a few
Harvard.
other people who work with me.
Yeah,
Yeah.
yeah.
They kind of just because I mean I don't offer like destination training. So Dr. Polpat does. So we collaborate. He has an orthopedo office. So if you really, really want to learn to do things like you want to learn how to place expanders in person, you can come to his office for an afternoon, and his prices are very affordable. And you can basically watch him. If you're licensed in Arizona, he'll actually let you do it, but otherwise you get to watch them do things, and they'll also train your team if you want to bring them along. So I highly recommend it. And then his wife, Dr. Bansi Popat, she has her MBA from Harvard, and she helps out with insurance. So that these are areas that supplement what I do. We all collaborate.
Dr. Meta Wilson, thank you so much for your time. I know you have kid, you have other
Thank you.
activity, you are busy mom, but you are a super mom. I thank
Thank
you so
you.
much for everything you
Thanks,
do
Doc.
for the community, for the world. The world
Thank
can check
you.
out your YouTube and learn so much, especially those who do in dentistry. I just want to shout out for your inspirational way of teaching, a lot of YouTube video that can be useful. The young generation, if you guys just graduate and need to learn more about how you can uh, combine ortho and GP or pediatric, feel free to check out her YouTube channel and her website. Uh, Thank you again,
you.
Dr. Amanda.
Sure.
Have a
Thank
wonderful
you
day.
so much. Have a great day and have a great trip to Hawaii. Take
Thank you.
care.
Yep,
All
I'm
right.
leaving tomorrow.
Bye. Okay, okay, cool.
Thank
Thank
you.
you.